Hello, my name is Joshua Garcia, and this is my report on approaching addiction. So the main topics and arguments of this report. So the reason for writing this report is to provide a possible course of action for Vanguard Behavioral Health Center, which is a local treatment center in Albuquerque, New Mexico. The goal of Vanguard is to continue treating addiction while also reducing the number of those facing substance use disorder in the local area. So a quick rundown of the methodology. So this is a summary of the sources that I had gathered. And these are the sources that I got my information from. So first was a Dicycle medical journal. So from this medical journal, it was a peer-reviewed journal that examined the relationship between substance abuse and repetitive trauma. It summarized a study conducted in Turkey that studied substance use rates in the population of men who reported having severe trauma. This source was very important because it gave me valuable information on the underlying causes of substance use, and it gave evidence for the link between underlying trauma leading to substance use disorder. My next source was a harm reduction journal, and this is also a peer-reviewed journal that detailed a survey completed by a harm reduction facility in Vermont. These surveys were done to obtain information on various facets of drug addiction among different sociodemographics. This piece gave me valuable information about current addictions, but offered unique knowledge on how future prevention efforts can be made more effective. So here is a quote from the journal itself. The findings highlight the important role of SSPs in providing community-based services and providing knowledge that can inform future intervention services and treatment provision in this setting to help address the ongoing overdose epidemic. So SSPs, just for reference, are a prevention program. These are my other sources, the Administrative Law Review. This piece is a commentary on the current actions taken by the FDA, which the author believes have created the perfect environment to combat the current opioid crisis. They offer a well-researched argument. This piece is useful as it provides a strong argument that aligns with the recommendations that I offer in my report. This administrative law review argues that the issue of overprescribing opioids needs to be addressed, and it states, the CDC and HHS believe that better information and communication could substantially shrink the opioid epidemic, and without acting, the FDA would fail to address a grave risk that is just as dangerous as the side effects of opioids. The next source was a Hispanic Journal of Behavioral Sciences. This article outlines the current strategies being employed by Familias Unidas, a substance abuse prevention program that primarily serves immigrant families. The strategies offered by this program have proven effective, showing that prevention can sometimes be just as powerful as treatment. This piece is one of the most valuable as it talks about the effectiveness of educating families in preventing substance abuse. These were my last two sources, the New Mexico Department of Health. This was just a report from the Department of Health on the state of substance use in New Mexico. It gives facts and statistics on the current rates of substance abuse in the state, but it also states which prevention strategies are being shown to be effective. Another report was from the Legislative Finance Committee. This report is by far the most informational, with it being an update of current funds being used by the state to combat substance use addiction. It gives insight into how resources are currently being used in the state, what is working and what is not working, and it is useful for my report because it shows how the state has gone about substance use thus far. So these are the results from my entire methodology section. So after conducting this research, I have discovered that although efforts are being made to increase the effectiveness of current addiction treatment, many of the strides to be made can be found in prevention efforts. Many addictions begin as the result of separate underlying issues, which are mental health and trauma, overprescribing, lack of education on substance use. The current potential of prevention efforts is not being fully utilized by the state, as much of the budget allocated for this cause is not being spent. Education for parents and their children is among the best prevention efforts. So, for the methodology, what I gathered from most of my research was just that proactive versus reactive approach. So this is one of the main problems. There is a lack of focus and education on substance use disorder. Much of the budget for the prevention programs is not currently being used by the Department of Health. Addiction centers, as well as other agencies focused on fighting addiction, are fighting an uphill battle. And as the root causes of addiction are not being addressed. And right here, the access. So one of the main problems is a lack of access to um, to addiction treatment and also addiction education. There's also a lack of access to mental health therapy as well. So the solution that I'm proposing, so there's multiple facets to the solution. So first, creating educational pamphlets to disperse to the community. As my research gathered, that educating people on addiction is one of the most powerful tools to stopping it. Providing information on obtaining access to mental health resources, school-based educational programs for kids and parents, reaching out to other addiction centers to collectively push for the proper use of the prevention budget, and continuing to bring awareness to the issue of the overprescription of opioids and other substances. So these are, I think, are possible solutions that we as an addiction center could provide. So implementation. So in order for this to work, we would obviously need, well, we couldn't do this alone as just one addiction center, so we would need the support of other local addiction centers. Many of the facets of this plan cannot be implemented by us alone. So another step to this would be utilizing our staff to create clear and effective educational material, as I think as an addiction center, we have very educated staff on substance use disorder. We would then disperse this educational material to the surrounding community, and we could also offer classes for parents on preventing substance use in children. The benefits to my solution. So, as I stated earlier, as an addiction center, we have very valuable knowledge of substance use disorders and firsthand experience that we can share. This plan would receive more benefits the longer it is used and the more it was implemented. Prevention strategies are effective in reducing substance use abuse rates, and it is a different approach to what is currently being tried, because I think if it's not already reflected in our state that the current strategies we're using are just not working, as the numbers just keep skyrocketing. So these are more steps towards my solution. As stated before, reaching out to other addiction centers is crucial. So we would first reach out to Turning Point Recovery Center, New Season Treatment Center, Icarus Alcohol and Drug Rehab Centers, and other local treatment centers. We would work alongside them to create proposed educational material together, while also reaching out to state officials to communicate the necessity of the proper use of the prevention budget. So it would take all of these treatment centers together to put pressure on the local government to use money allocated for treatment. Reaching out to and urging both the public and private mental health service providers to expand access to mental health services, as one of the biggest problems was the lack of access to mental health services. So the costs and the challenges of this plan, it would take a small chunk of the current budget to be reallocated. It would take a small amount of resources away from current treatment strategies, and this plan is heavily dependent on the support of other resource centers. So this is my cost benefit analysis. Despite the cost, I do think this is a feasible plan. Overall, the benefits of this plan do outweigh the costs. If the short-term challenges could be overcome, this plan would pay for itself. Less people addicted would mean that less money would have to be spent on treatments. This is the summary of all my findings. In the fight against addiction, more and more evidence points to the fact that a proactive approach may yield better results than a reactive one. Although it is important to continue treating those currently fighting substance use disorder with the best treatments possible, it is crucial to increase our prevention efforts to curb the current epidemic of substance use that we are facing. As organizations on the front line of this issue, it is important that not only our addiction center, but others do what the research suggests and begin tackling these issues at their root causes. Thank you. I hope you enjoyed this presentation.